Hello. In these next slides, we will cover 4 different mental health conditions. They are phobias, depression, postnatal depression, and bipolar disorder. Learning outcome 4 is about understanding phobias, the causes, the effects that they have on individual and others. As we've talked about before, this is your family, next of kin, friends and work colleagues. You also understand how to manage it and support individuals with it. The first part is you must describe the 2 main groups of phobias, which are defined by the NHS and Mind. You'll then look at the causes of phobias, describing a range of contributory factors such as prolonged stress, anxiety, dysfunctional relationships, poor living conditions, and possible family links. You'll then be asked to explain how specific phobias can impact on an individual's daily life, looking at avoidance behaviour as one of the disabling effects of phobia. And then looking again at the effects of agoraphobia, such as avoidance strategies, loss of social contacts, and limited access to services, and their associated effects on both the physical and mental health. And then looking at, for example, the effects it has on family and friends. This slide looks at a range of examples of self-help strategies and support, such as adopting positive thought processes, relaxation, a graded self-exposure to the phobia, which will then build confidence for the individual. You should be able to provide examples of both drug treatment and non-drug treatment, which would be used to treat the phobia. Non-drug treatment could be something like mindfulness, yoga, swimming, and the self-exposure to whatever the phobia is. You should be able to describe a range of treatments and resources available to the individual locally to them, including examples of sources of support available, which may be accessible through the community mental health team, NHS, mental health organisations, and various support groups. Learning outcome 5 is causes of depression. In this learning outcome, you'll gain an understanding of depression, its causes, and how it can affect individual and others, family, friends, work colleagues. Also gaining a way of understanding how depression can be managed. You will need to define the term depression, being aware that people can be affected by different types of depression, ranging from mild to severe, which is classed as clinical depression. You'll also need to understand what is meant by psychotic depression and how it differs from depression. You should describe additional factors associated specifically with psychotic depression. For example, hallucinations, delusions, and thought insertion. You'll also be able to describe a range of contributory factors, such as biological and genetic factors, how some types of medication can cause problems, use of substances, and how certain events can trigger depression. And you must describe a range of examples of how depression can affect both an individual's daily life and their life chances. All of this you will do through self-research, through Google, and some of you may have scenarios from your own family and life that you can draw back on. You should be aware that family and friends can respond in different ways depending on their understanding of the condition. Sometimes potential tensions within relationships can cause problems, and also consider the potential effects of supporting an individual in practical terms for family and friends who is suffering from depression. You should describe how a range of physical, social, emotional, and economic demands on daily life can contribute to ongoing depression. You will be asked to describe a range of pharmaceutical and non-pharmaceutical treatments available to treat depression, and to explore treatments and resources available to individuals in their locality, including the support available which may be accessible again through the community health team, NHS, mental health organisations and support groups. You'll be asked to identify some pharmaceutical and non-pharmaceutical treatments used specifically to treat psychotic depression. In this, they may also ask you to consider specialist support available to manage this condition. Learning outcome 6 is understanding postnatal depression. In this outcome, you'll gain an understanding of postnatal depression and its causes, looking at again how it affects others, the individual, family members, friends and work colleagues. And you'll look at how postnatal depression can be managed. You'll be asked to define postnatal depression within the clinical context. You'll be needed to note how short-term mood changes many mothers experience within the first few days following the birth of a baby, which is called baby blues, are different from postnatal depression. You'll then need to look at and describe a range of predisposing risk factors that may contribute to the likelihood of an individual developing postnatal depression. These could be from genetic and socio-economic in origin, or associated with the conception, the pregnancy, labour and delivery of the baby. And going on to describe the specific features of puerperal psychosis, which is also known as postpartum psychosis, which is different from postnatal depression. I find this unit really useful and very interesting. I hope you will too. Following on in this slide from postnatal depression, you'll be asked to describe the feelings of an individual who's gone through postnatal depression, how it affects the mother individually and in terms of forming an attachment, otherwise a bond, with the baby. You should also recognise the importance of healthy attachment for the baby and the potential long-term effects on their development without this. The postnatal depression, how it affects family members. Again, you should describe a range of self-help measures that mothers can use for support when experiencing postnatal depression, and how both pharmaceutical and non-pharmaceutical interventions that potentially could be used to treat postnatal depression. Looking at exploring treatments and resources which are available to the individual in their own locality, and again such as using the community mental health team, NHS, mental health organisations and support groups. The final two outcomes are about puerperal psychosis, otherwise known as postpartum psychosis, and it's looking at the specialist treatments and resources which are available to mothers that are diagnosed with this. In Learning Outcome 7, you cover understanding bipolar disorder. You'll gain an understanding of its causes and the effect it can have on individuals and their daily lives, how it can be managed, how it affects others. You should provide a definition of bipolar disorder within a clinical context. You'll also look at the different types of bipolar disorder and how manic episodes and depressive episodes are a feature. You should also be aware that it is thought there are a combination of factors that can contribute to bipolar disorder. And you should be able to describe a range of possible causes, such as genetic and environmental. You should look at and to be able to describe a variety of feelings an individual with bipolar may experience at different times. Looking at a range of ways an individual may be affected, both positive and negative, such as an increased intensity, creativity or low mood, sleep disruption, risky and impulsive behaviour. And you should be able to explain how family members and friends might have to adapt support, and that tensions may occur if they have difficulty understanding the associated behaviour and fluctuating moods that individuals with bipolar may have. This final slide in this section, you will look at a range of demands on the daily life, such as financial, work, family problems, which could increase stress and trigger bipolar episodes. You should provide examples of at least 3 symptoms of a manic episode and 3 symptoms of a depressive episode. You should provide examples of different pharmaceutical or clinical interventions which are used to treat bipolar disorder. You'll also need to consider a range of self-help strategies individuals can use when entering a manic and depressive episode, and explore ways that an individual can recognise their own triggers, looking after physical health, establish an informal support network, maintain a work-life balance, and reduce stress wherever possible. You should also be aware that support from family and friends will vary depending on their understanding of the condition and how it affects the individual. Also to consider is education and how this can help family and friends to be alert of early warning signs of a manic and/or depressive episode, and to take appropriate action to support the individual. You'll also need to explore treatments and resources available to the individual who has bipolar in their locality, including the support which may be accessible again through the community health teams, NHS, mental health organisations and self-help groups.